All right, so good afternoon. Thank you for joining the Medicare 101, What's New in 2022. So this webinar is sponsored by Autumn Leaves, Parkwood Retirement, Parkwood Healthcare, Monticello West, Signature Point, and Walnut Place. We're communities managed by Life Care Services, an LCS company that partners with over 140 communities across the nation to serve more than 35,000 residents. We're excited today to have Bailey Wingard, licensed Medicare licensed broker with Medicare Foundations. She's with us today to help us better understand and provide you with information you need during this enrollment period. During the event, we ask that you mute your mics, turn off your cameras, and we'll be recording the event. So you'll have a link sent to you later so that you can rewatch. And at the end of the presentation, we can open it up to questions. We'll use the chat feature, so we ask that you please enter your questions into the chat, and then I'll be able to ask them on your behalf to Bailey. So Bailey, thank you for joining us today.
Yeah, thank you for having me. Appreciate it. So I'll just go ahead and get started. So as Teresa said, my name is Bailey. I run Medicare Foundations here in Keller, Texas, so not too far away from Dallas. And, the reason I'm going to be talking about Medicare 101 is that I know, you guys or your parents are getting inundated with all this marketing information from all the different insurance companies. I know that's really overwhelming, but what's not being dispersed is a lot of just Medicare knowledge, the basics. And I know that's not really something that's readily available out there, on the web and right to your doorsteps, what all the different insurance companies are doing right now. So we're just going to be talking about the basics. I will go ahead and flip to the next slide. Oh, there we go. Okay. Got a little nervous there for a second. So I'm your presenter. My name is Bailey Wingard. I'm with Medicare Foundations. And today we're just going to cover, what Medicare is, what it isn't, who's eligible, all the different parts, including Advantage plans, supplement plans, summarizing all that with what your options are. And then lastly, kind of talking about the different enrollment periods, including the one we're currently in. So for starters, Medicare, strictly talking about parts A and B, it is federal health insurance that is funded by the FICA taxes that you or your spouse paid during your time of work. Now, there are a lot of misconceptions when it comes to Medicare. So I kind of want to go through the most common ones. Medicare is not Social Security. There is a really common misconception with Medicare that you have to be receiving your Social Security income in order to qualify for Medicare. That is totally incorrect. They're very separate programs. Likewise, with Medicare and Medicaid, Medicaid is state assistance from the state that provides you help with paying those medical bills. That is different from Medicare, but they can work together for specific plans called dual plans. And then third, it's not family health care. With Medicare, it's individual, so you can extend it to your family, your friends, your children, anything like that. And then lastly, I think the most common and the most unfavorable and the most incorrect misconception about Medicare of all is that it's free. There are certain segments of Medicare that are $0, but this is only earned if you have worked and paid taxes. So I totally disagree with that. And even those sections that are $0, you still have to pay, co-payments and deductibles and all that. So I think Medicare gets a bad rap and people assuming that it's free. And I definitely disagree with that. Kind of moving on to who is eligible, there are three main groups. The biggest one is going to be those who are around 65 years old and older. The second one is going to be those who are disabled receiving Social Security disability income for at least 2 years. And then the last group is going to be those characterized by having end-stage renal disease or ALS. So those are going to be the three main. The next thing I want to go through, because I do mention this throughout the PowerPoint, different insurance terms I just want to go through. Premium is a big one. That's going to be a fixed amount that you're going to pay per month for your coverage. Deductible is the next one. It's a set amount that you pay 100% of before your coverage is going to kick in. And then after you pay that deductible, there's going to be co-payments and co-insurance. When it comes to co-payments, this is a fixed amount that you're going to pay for a medical service. Co-insurance is very similar, but it's going to be a percentage of the cost you're going to pay for medical services. So very similar. Starting with the different parts, Part A is going to cover many different things, hospitalization, skilled nursing, home health, and then hospice. The big thing to remember with Part A is hospitalization. That's going to be the most important coverage for Part A. As far as cost goes, it is a kind of a big question with Part A and its costs. For most people, I kind of mentioned it earlier, as long as you have worked in the US and paid FICA taxes for at least 10 years, you will get Part A for free. It'll be, well, I don't want to say free, for $0. And then when it comes to the coverage of Part A, it is a bit confusing because there is a pretty big deductible. It's about $1,500. It did go up in 2022, and that's going to apply to each benefit period. So unlike most health insurance policies where the deductible applies to just the year, this one is going to be per benefit period. And, we can kind of get into that later. With Part B, it's going to cover multiple different things, as you can see, ambulatory, emergency services, preventative services, mental health, durable medical equipment. But the big thing to remember with Part B is going to be doctor's visits and outpatient care. Now, Part B cost, this is another big question, and I do, want to take some time to address this. With Part B, most people are going to pay in 2022, because it did go up from $148.50 to $170.10. That is the most common, but I want to mention that it is based on your income. So if you make above a certain amount of income per year, then you'll actually have to pay more for Part B. Likewise, there are late penalties attached with Part B. So let's say you're eligible for Medicare, you turn 65 and you wait a couple years before you actually want to enroll in Part B. It's actually going to be an increase of 10% for every year that you didn't have Part B when you were eligible to have Part B. So it is a real push to get Part B right when you're eligible, but I do want to mention this. You can avoid those late penalties if you have credible coverage during that time. So most common type of credible coverage is going to be employer coverage. And then the Part B deductible, that's a set amount that you have to pay 100% of before the coverage kicks in. It did go up in 2022, went up from $203 to $233. And then for most medical services with Part B, it's going to be a 20% coinsurance. So you pay 20% of the cost. So those are the two segments that come from the federal government, Part A and Part B. Together, that's going to make up original Medicare. Trying to get to the next slide. So that's original Medicare. That's what you get with that red, white, and blue card. And so we kind of have a grasp of what is covered, but we don't really understand what is not covered. So I do want to go over that. There's quite a few things that is not covered by original Medicare. Big ones are dental, vision, and hearing, and then all the kind of equipment that comes with that. Prescription drugs is a big one, and then some other ones that's not covered: long-term care, care received outside the U.S. And then a big one that's not really typically discussed: if you just have original Medicare, doctors are allowed to bill you excess charges, which is 15% higher than they would normally charge. Now, if you guys have gone to the doctor, and you'll see that doctors will actually charge you as much as possible, honestly, and then you'll see that the insurance will kind of knock it down to the set amount that's approved for it to pay. With original Medicare, they can actually bill 15% higher than that, and that's legal, and the Parts A and B won't cover it. And then last but not least, original Medicare is not going to have an out-of-pocket limit. So it's never going to have a number that's going to limit the amount that you could ever spend on medical bills. So it can leave you in a bit of a financially uncomfortable, let's say, situation. So that's, everything that Parts A and B doesn't cover. So let's talk about, plans that will cover this. With the Medicare Advantage, this is going to be the second option. So the first option was original Medicare. Second option is going to be Medicare Advantage. To be eligible for this, you have to have Parts A and B, and this does mean you have to continue to pay that Part B premium. And lastly, you have to be in the Medicare Advantage plan's service area. With Medicare Advantage, it's going to cover multiple different things. It's going to cover, majority are going to cover dental, vision, hearing, and then also prescription drug coverage. The actual coverage itself, legally, Medicare Advantage plans have to cover everything that original Medicare covers with as good or better coverage. So everything that Part A and B we just saw, Medicare Advantage plans will also cover that. When it comes to cost, a majority of the plans, depending on your area, will be $0. So you won't have to pay anything more than that Part B premium. When it comes down to the brass tacks of co-payments, co-insurance, deductibles, that really does vary by the plans, because these plans are actually offered by private insurance companies. So there's much more variability in exactly what your coverage is going to be. And then last but not least, certainly not least, all Medicare Advantage plans have out-of-pocket maximums. Now this is massive. This is huge because just as I was talking about with original Medicare, there's no out-of-pocket maximum. With Medicare Advantage plans, they'll actually provide you a number that's going to cut off the amount that you could ever be liable for as far as medical costs go. So, once you reach, let's say it's $4,000 within a given year, the insurance company will pick up all the rest of the medical service costs for the rest of the year. So it's extremely, extremely important to have that, in my professional opinion. Two other questions, very common with Medicare Advantage. Medicare Advantage plans do have networks, and there are 3 different types of Medicare Advantage plans that I'm going to go over on the next slide. And then underwriting. Medicare Advantage plans do not have underwriting, and I do want to pinpoint exactly what underwriting is. This is when they're going to take a look at your medical history and your current medical circumstances to decide whether they're going to accept you or deny you for the plan. Medicare Advantage plans do not have underwriting, so you won't have to worry about acceptance or denial or having a higher premium due to your health. These are going to be the main Medicare Advantage plan networks. We have HMOs, PPOs, and then HMO POSs. HMO is a health maintenance organization. You guys won't need to know that, but it's just a fun tidbit to kind of throw in there. With these, they are a bit more restrictive. So you are required to choose a primary care physician, rely on that primary care physician to get referrals to see specialists. And if you go out of network, you'll actually pay 100% of the cost. You won't have any coverage if you go out of network and see out of network doctors or hospitals. With PPOs, kind of the opposite. With this, you're not required to choose a primary care physician, and you're not required to go to that primary care physician for referrals to specialists. With coverage, you're going to have coverage in network and out of network. Now, with out of network coverage with a PPO, it's not going to be as good as in network coverage. So with any of these plans, it is always a good rule of thumb when it comes to Medicare Advantage plans to stay in network, just to, financially kind of save yourself there. And then the last one is going to be HMO POSs. This is a fairly new one. You are required to still choose a primary care physician. Majority of services may require a referral, but it does depend on the service. And then likewise, it's going to have some out of network coverage, but that is also going to depend on the service. And it does come down to what each individual company has created their plan to cover. So you have to kind of check each individual plan. So those are the 3 types of Medicare Advantage plans. And this kind of summarizes the second option, which is Advantage. Moving on to the third option is Medicare Supplement plans. These are kind of the exact opposite of Medicare Advantage plans, if you will. With Medicare Advantage, there's a $0 premium. With Medicare Supplements, you pay a premium. But they do have some stuff that overlaps. For example, with Medicare Supplement, just like Medicare Advantage, you still have to be enrolled in A and B, which means you have to pay that Part B premium still. With the actual coverage, we talked about earlier how majority of the medical services with A and B, you're going to see an 80-20 split. So the government's going to take 80% of the cost, and then you'll be responsible for 20% of the cost. What Medicare Supplement plans do is they're going to pick up the pieces that original Medicare doesn't cover. So they're going to kind of fill in the gaps, which is why Medicare Supplements are often called Medigap. Fun little fact. But with Medicare Supplements, there are also some downsides. There's pros and cons to everything. With them, there's no built-in dental, vision, or hearing, and then there's no prescription drug coverage as well. When it comes down to cost, it's a tricky question to answer because the cost is really going to come down to exactly which Medicare Supplement plan you got, which company you went with, and also age, most importantly. When it comes to Medicare Supplements, the plans are going to be standardized. This means if you decided to go with a Medicare Supplement Plan G and you were taking a look at the coverage and you wanted to compare a Plan G with, let's say, United Healthcare to Aetna's Plan G, the coverage is going to be the exact same. They're standardized. The only reason you're going to see differences at all is going to be in premium, how stable that premium is, and then additional benefits that the company will kind of provide, such as discounts or gym memberships, stuff like that. Moving on to some other really important questions with Medicare Supplements. Do they have networks? No, they do not. So I want to kind of include original Medicare with this. Original Medicare and Medicare Supplements do not have any networks. So this means if you go to the doctor and you have a supplement or you have just original Medicare Parts A and B, all you would have to ask is, do you accept Medicare? And if they say yes, you're rocking and rolling pretty much. With Medicare Supplements, is there underwriting? Yes. However, there's no underwriting if you get into a Medicare supplement during your guaranteed issue period. This is going to be a time that is 6 months after you enroll in Part B, and then if you are coming off employer coverage. So there's going to be the two main times that it's going to be important to enroll in a supplement then if you don't want to go through underwriting and you do want to supplement. And then coming up on Part D, this is going to be the prescription drug coverage. With Part D, you can be enrolled in Part A and or Part B. So you can have one or the other or both and be eligible for Part D. Part D is going to be prescription drugs, and the cost associated with this is also kind of a tricky question because prescription drug plans are offered by private insurance companies. So it does come down to the plan that you get, which company you get. Premiums, deductibles, co-payments, co-insurance, that's all going to vary by plan. And then I do want to mention that with same as Part D, there's going to be late penalties that apply potentially. And there's also going to be what's called IRMA penalties. This is what I was talking about earlier, that if you make above a certain amount on income, you're actually going to have to pay more for your Part B. Same applies to Part D. It's called an IRMA penalty. It's an income-related monthly adjustment amount. So you do get somewhat penalized if you make over a certain amount of income. And then late penalties also apply for Part D. This is going to be if you decide not to get a prescription drug plan, you're eligible for it, and you wait years and years or months and months, you're actually going to have a late penalty based on each month that you didn't have prescription drug coverage from a private insurance company when you were eligible. And we can definitely chat about that more as well. That can be super confusing. So let's talk about some other confusing stuff as well. So with prescription drug coverage, you can either get it from a standalone plan or you can get it built in with a Medicare Advantage plan. Now, it is common for people to say, well, can I just get a Medicare Advantage plan and then also get a prescription drug plan on the side? You cannot. If you try to have a Medicare Advantage plan with built-in prescription drug coverage and you try to get a standalone prescription drug plan as well, the insurance companies are going to just disenroll you from whichever one you enroll in after the fact. So it's tricky for sure. Another tricky thing is going to come down to the prescription drug phases. So with prescription drugs, this is something that's regulated by the government, so it's kind of hard to get out of it, but it applies to all prescription drug plans. There's different parts. So during the deductible phase, this is going to be amount that's attached to the plan. Occasionally you'll see $480. That's a very common prescription drug deductible. You'll have to pay $480 total in order to move to your regular coverage, the initial coverage phase. So this is when you're going to be paying those regular co-payments and co-insurance that you're going to see on the summary of benefits for your specific plan. Once you and the insurance company have reached $4,430 in total paid for your prescriptions, you're going to move into what's called the coverage gap, also known as the donut hole. With this, it's a super fun time where you get to pay 25% for both brand name prescriptions and generic prescriptions. This can be very tricky because you're not quite sure what 25% could be of the retail price. Once you've reached the end of this and you and the insurance company have paid $7,050, you're going to move into the catastrophic coverage period. And during this period, it's actually much, much easier. You're going to pay somewhere around $3 for generic prescriptions and about $5 for brand name prescriptions. And then or whatever is higher, 5% or that $3 or $5. So it does get pretty tricky, but you're pretty much set if you reach the catastrophic coverage phase. You're not paying too much for your prescriptions. And then I just kind of want to summarize with, what are your options? Because we went over a bunch of different things. This slide is really for people who have the option of everything. They turn 65, they have everything available to them. The first option they're going to have is to just get Part A and B, and then add on that standalone prescription drug plan. And the reason I do include that standalone prescription drug plan with the original Medicare is because we want you to be able to avoid all those late penalties. Now, even if you say, oh, well, I'm not taking prescription drugs right now, I don't need a prescription drug plan, I just want to have A and B, we still definitely recommend just having a prescription drug plan. You can get the one with the lowest premium, something like $6, and you can avoid that late penalty, which is huge. Second option is going to be Medicare Advantage plans. We went through this. They're going to include, everything that A and B includes with added dental, vision, hearing, and typically prescription drug coverage. It's going to have that out-of-pocket maximum, It's a good idea for some people. And then last option is going to be Medicare Supplement. That's something that you're going to add on to that original Medicare. It's going to cover those costs that original Medicare doesn't cover. And then, like I said earlier, it's not going to cover any prescription drug coverage. So a standalone plan is definitely advisable for sure to avoid those late penalties. And then, lastly, it doesn't include any dental and vision. If that is something that you truly prioritize and you would like to have coverage for, then there's also standalone dental vision plans that are available as well. And last but not least, I'll just kind of briefly go through this. There are 3 main enrollment periods when it comes to Medicare. The first being initial enrollment period. This is going to be a 7th-month period around your 65th birthday. So it's going to be 3 months prior to the month you turn 65, the month you turn 65, and 3 months after. And during this time, you have all those options available to you that we just saw on the last slide. So it's very important to decide exactly what coverage you want. This is going to be when you're first eligible for Medicare. Next, we have the annual enrollment period. This is actually what's happening right now. Very exciting. It's October 15th to December 7th. This is when all the different insurance companies will release new plans and kind of alter their current plans. They'll change the benefits. Doctors' networks might change. Prescription drugs, whether they're covered or how they're covered, might change as well. But most importantly, this is a time for Medicare beneficiaries to be able to change their plans. And this is, I don't know if it's professional to say a free-for-all, but it really is a free-for-all. So anyone who's on an Advantage plan can make a switch to another Advantage plan or make a switch to just original Medicare and vice versa. There are a lot of changes to be made, so definitely take advantage of this time, especially if you're on original Medicare and you're thinking about a Medicare Advantage plan, because this is going to be the only opportunity for that. With this, you have up until December 7th to find a plan. Whatever plan that you have enrolled in December 7th, that's going to be the one that's effective January 1st. Now, let's say that you have a plan effective January 1st and you're in it for about a month and you recognize this is not the plan I wanted. I don't enjoy this plan. I would like to switch to a new one. This is when the open enrollment period becomes really, really important. This is January 1st to March 31st, and it's going to be a time that I like to call a correction period. If you pick the wrong plan during the annual enrollment period, you're allowed a one-time switch from an Advantage plan to another Advantage plan or a Medicare Advantage plan to original Medicare. So this is a very important time if you feel like you picked the wrong plan, or if something comes to light and you recognize that a better plan might be available. And then, the 2 ones that I just kind of want to throw in there, special enrollment periods do occur throughout the year. One in particular that we just had this past year was the Snowpocalypse special enrollment period. This was a FEMA enrollment period that actually lasted for about 7 months from February to the end of September. So these enrollment periods do kind of pop up throughout the year. So there might be opportunities to change later on, but truly you need to kind of pay attention to the enrollment periods like annual enrollment and open enrollment. Those are going to be the ones to rely on. And then last but not least, Medicare supplements, unlike Medicare Advantage plans, you're available to enroll year round, but obviously it is subject to underwriting. So you want to be cognizant of that. But that is it for me. Does anybody have any questions? I should probably check the chat. Okay, well, if nobody has any questions, then I think we're good to go. And I appreciate you guys listening to me ramble for quite a bit now.
Yeah, I don't see any questions either in the chat. So thank you, Bailey. I appreciate it. This is very helpful.
Yeah, absolutely.
I have a quick question if you could.
Yes, sir, absolutely.
I've been to Medicare. I'm 78 years old, and I've been to Medicare Advantage plan for a good number of years. What would be the difficulty of switching back to regular Medicare?
So not difficult at all. This would be the time to do so, or the open enrollment period. And that's just calling your company and saying, I would like to switch back to original Medicare.
Okay, thank you.
Yeah, absolutely. Cool. I will put my information in the chat. I am available at any time just for regular Medicare questions, anything you have. if you want to talk about your specific company's plan, I could definitely talk about that as well. I love chatting about Medicare, which sounds fake, but I actually do very much enjoy it.
All right. Thank you. And the teams will also be reaching out and providing your contact information.
Perfect.
Thanks, Bailey, and thank you everyone else for attending today. We appreciate your time.
Yeah, absolutely. I really enjoyed this.
All right. Take care. Oh, if switching back to regular, it might be difficult to be accepted by a supplemental.
Yes, absolutely. So if you're going to be switching back to original Medicare and you're not during your initial enrollment period or guaranteed issue, getting accepted for Medicare supplement definitely can be tricky, and that you will have to go through underwriting. And depending on the company, they can be pretty strict with their underwriting. If they do accept you, it is possible they could make your premium higher. So you also have to look out for that. That is a good question, though. I was just chatting about that earlier, too.
Great. All right. Well, thank you very much.
Yeah, absolutely.
Thank you.
Yeah, if anybody has any other questions and you can't type fast enough, just feel free to give me a call, shoot me a text, or shoot me an email.
Thank you, everybody. Have a great day.
Thank
Yeah,
you.
thank you.
Do the same. Thank you.